Hello, my name is Megan Wieringa, and my current address would be 7515 Red, as in the color, Osier, Osier, Byron Center, Michigan, 49315. And I hope to be the next child life intern at the Children's Hospital of Michigan. I graduated from Hope College in Holland, Michigan, with additional classes from Western Michigan University. I am currently employed at Behavioral Solutions, tutoring autistic children. My volunteer experiences include a summer at the University of Michigan's Metro Health Hospital and a summer at Mary Free Bed Rehabilitation Hospital, working in their inpatient pediatric departments. I also spent time in Uganda, Kenya, and the Dominican Republic, working with underprivileged children. In my own community of Grand Rapids, I volunteered at the First Tee, helping children learn life lessons while teaching them the game of golf. I have also spent time in my community tutoring special needs children. My leadership skills include being captain of my college golf team, being a young life leader to middle school age girls, and creating and developing a health food company. The strengths I bring to this job are creativity, flexibility, positivity, and I am team-oriented. I completed my practicum at the University of Michigan Metro Health, where I have had experience in both in- and outpatient units. Throughout my practicum, I introduced services, implemented therapeutic activities, and participated in appropriate patient-led play. I also provided assessments of the children and families and was involved in charting notes. In regards to question number 1, child life has played and is continuing to play a significant role in the healthcare environment. When people ask me what child life means to me, I explain the profession as a way to help children cope with the stressors of hospitalization. From my experiences with hospitalized children, those stressors are different for each child. One thing I have discovered about children in hospital settings is that each child copes with grief, illness, and treatments differently. Throughout my volunteer and practicum experience, I meet children where they are socially, developmentally, and emotionally to help them face the challenges they come across in the hospital. Child life is different from every other profession because it uses therapeutic play as a means of helping patients. Through play, child life specialists can create a bond that builds trust. Creating trusting relationships allows children and families to open up and express fears and concerns they have that they might not otherwise tell a doctor or nurse. My dream as I am becoming a child life specialist is to enhance children's experience in the hospital so that their coping and developmental skills will continue to grow once they leave the hospital environment, resulting in a positive outlook for future medical encounters. In regards to question number 4, initiative to me means taking the lead and making a decision that is best for my patient. For example, I'm currently doing ABA therapy. It stands for Applied Behavioral Analysis. I'm tutoring autistic children in their homes. Each child is very different on the autism spectrum. I've had to learn to adjust and figure out how each child learns best. For example, I tutor a little 5-year-old boy, and I have had to earn his trust by giving him small rewards often. I can tell when he is starting to get upset and frustrated. I am teaching him to ask for appropriate breaks before he gets too upset. I often take the initiative by prompting him to ask permission to stop his tasks, verbalize his need for therapeutic play or activity. I am hoping this will soon become independent in the process soon. In regards to question number 3, Annette Fiske was an early theorist that always comes to mind throughout my schooling and practicum. She focused on the importance of encouraging families to be there during the healing process. When I volunteered and completed my practicum, I would always encourage parents and or close relatives to be as involved as possible in what they were doing. It's not only important for them, but for the children to increase the healing process. I always want children to feel safe, and parents have the ability to do this. If a parent wasn't able to be there for some reason, I would always ask the child if they would feel better if we included their parents or relatives via FaceTime. I've noticed parents bring a calming measure that child life specialists can't always bring to a room. In regards to question number 2, my ideal supervisor would be someone who gives me guidance but allows me independence. I would want a relationship where I could go to my supervisor with any of my questions, concerns, and seek appropriate answers. In regards to question number 5, I am excited to take my knowledge and skills and serve the Children's Hospital of Michigan and the children whose needs they meet. Your exceptional child life program and your community engagement serves as an example to other hospitals. Thank you so much for this opportunity, and I hope to hear from you guys soon.